Devi, working as Reader, Department of Audiology at All India Institute of Speech and Hearing, Mysuru. I am here today to share few information about auditory verbal therapy. The most common question that arises in parents of children with hearing impairment is that, how will my child communicate? How will I communicate with my child? There are numerous options that are available for this question. With the implementation of systematic national-wide newborn hearing screening program by Government of India, the age of identification of hearing impairment and rehabilitation with appropriate amplification devices or cochlear implantation has reduced significantly. In such condition, the child's hearing and listening can be maximally utilized during the critical years for learning language through auditory verbal therapy. This method allows the child to learn to listen through amplification devices or cochlear implantation. It helps to learn language with meaning. This approach emphasizes on guiding and coaching parents or the caregivers to help the child with hearing impairment develop verbal communication, which refers to speaking, through use of hearing as the primary sense in their daily life. Let me give you an overview on few principles and strategies of auditory verbal technique as a parent which you can provide to your child with hearing impairment. First and foremost, a good listening environment needs to be provided. So, when a child is ready for learning language, minimize all the background noise like fan noise, TV sound, any music around, kitchen utensils noise, etc. This will allow the child to listen to speech sounds clearly. The next is speak close to the microphone of the child, hearing aid or the cochlear implantation. While speaking near to the microphone, don't raise the volume of the voice. Speak in a soft voice at a regular volume. If the volume is raised, this will distort the speech, which will be difficult for the child to understand. Always use hand cueing for the child to learn to listen. However, slowly this hand cueing can be faded off. Initially, use the speech that is repetitive and rich in melody with expressions and rhythm. Example, you can play a balloon, air balloon with your child, and while playing you can say, the balloon goes up, up, up in the air, which is more repetitive. Okay? Use more of acoustic highlights which can make the speech clearly for the child. Example, when you are speaking to the child, you can say, oh, you look so pretty today. This has more acoustic highlights in the speech. Most important is that don't use gestures or sign language or provide any visual cue of your movements of lip or the mouth for communication. Encourage the simple vocalization of your child and repeat the correct word by expanding it. Example, if the child says, boo boo, then say it clearly as, yes, that's a boat. Very good. Then the child should be provided with time to respond to sounds. So, wait after you speak and have a expectant look at the child like this. Always follow the normal speech, language, motor and cognitive development. Don't have high expectations above the age of the child. Administer ongoing formal and informal diagnostic assessment to monitor the child's progress, which will help you to plan further activities. These are only few. There are many more strategies. However, choosing the correct strategy requires interaction with your child by the professional. So it's always wise to contact the professional by choosing appropriate strategy and communication options. But remember, child with hearing impairment can learn to listen and speak with the parents' help and motivation. For more details, please be free to contact Department of Audiology, All India Institute of Speech and Hearing, Mysuru. Thank you.